Today, health insurance reform becomes law in the United States of America.
Health insurance costs are climbing.
How much healthcare costs have risen.
Rising healthcare costs.
What is really going on with healthcare costs?
Hey, I'm Robert with Common Care, and in the next few minutes, I'm going to be able to introduce to you why you should not be offering health insurance as your group health plan. Now, I realize probably right off the bat you're thinking, what penalties are steep for not offering that? And I get that, I understand that there are penalties, but we're not talking just group health insurance. I want you to understand that there is a difference between group health insurance and the requirement for a group health plan. We're going to go through this process together, and I promise I will show you legally how to meet ACA requirements that would pass any lawyer's stingiest requirements. First, let's start with why you don't need and don't want company health insurance as the offering to meet ACA requirements. Since we've been swimming in ACA waters for so long, it's hard to actually know how far we're sinking in them. So let's take a second and let's look at a different kind of insurance. Let's make a comparison here. Let's take a look at an auto insurer. You're not going to participate in an auto insurance policy that allows some drivers to wreck 5 vehicles a month, throw all those costs into the pot, spread the premiums around, and charge the reckless driver the same amount that you're still charging the responsible ones. What do you think in that scenario would happen to the premiums? What we're seeing happening with our current healthcare premiums. You have to recognize what is making the current landscape so undesirable. Everyone is being crammed into the same risk pool. It is a laughable idea, but you have to realize you are doing the same thing with your current group health insurance. Even those groups that are self-insuring are typically using documents, statement of benefits, and sometimes even administration from the insurance companies. It looks just like a group health insurance plan, and that's a mistake. But wait, you say, that's the exact scenario that the ACA created. We can't do anything about it. Wrong. The state-run competitive marketplaces can't do anything about it. Private groups can. The ACA definitions are based on your actuarial experience. It's true and unfortunate that you cannot structure plans to discriminate against the reckless behavior, except smoking. Cigarettes. You can smoke crack and get hospitalized once a week for the 10 years. And there will be no increase in premiums. You can, however, structure the plan to push down accountability to the individual participants. This is what common care plans optimize for, because the real-world results prove that that's the best method for everyone. But you might be asking the question then, how can I not provide group health insurance if that's what I'm mandated to do? That's what we want you to think of. Am I mandated to offer group health insurance? The answer is no. To comply with the ACA, you have to offer group health coverage, a word that does not mean insurance, that meets the following 2 requirements. First requirement is that it has to be affordable, meaning that the cost of the coverage cannot be more than 8.39% of their income for 2024. Second, the plan provides minimum value, which means it covers 60% of the actuarial value for the covered group as a whole. The definitions surrounding these 2 concepts are spread out. This is the tricky part about it. You have to look at tax law, healthcare law, HHS guidance, IRS guidance. It's a lot to try and go through to make sure that you are correct in your understanding the definitions. So what did everyone do with all of this? We let someone else take care of it. In this case, the health insurance companies. The problem with this is, A, I hope anyone can see that that's a bad idea. B, health insurers are subject to way less favorable rules than group sponsors. So, how do you not cram everyone into the same health pools? You give them their own risk pool. Employer-sponsored plans can provide so many options. The notion that paying for everything and offering comprehensive insurance is taking care of your employees is total nonsense. You have a budget as to how to take care of your employees and pay them. How you break that out between benefits and actual take-home pay doesn't change that budget. In fact, use it or lose it insurance premiums are probably the least efficient way imaginable to spend them. So take the total budget available to each employee and give the employees a choice of where to route that in order to meet their needs. The available routes for your participants can be anything from selecting that common and typical group health insurance all the way to cash in lieu because their spouse has the health insurance covered with their job. Doing things this way has several major benefits. First, everything works better when individuals have choice and accountability for their choices. Your plan will be efficient. and that means huge savings. Second, employees get great benefits that adapt to their needs and wants seamlessly. Third, you start to build up your own actuarial data and provider networks, especially with our help, and your plan gets exponentially better over time. So maybe by this time, you've been talked out of offering group health insurance as your only plan. But you might be thinking, well, that would then mean I have to provide all of this out of my own pocket?
No way. Not this time. Not this time. No way. Not a chance.
The answer is no, not if you structure it right. Remember, the goal of the Affordable Care Act was to offer minimum value affordable coverage to every American. The marketplace takes care of that for anyone not employed. And as an employer of more than 50 employees, you are mandated to offer that minimum value coverage as part of that shared responsibility. But that doesn't mean that has to be the only option. If you offer that minimum value coverage to all of your employees without discrimination, you can then offer right next to it more creative options that meet the needs of your employees, that can save you on tax dollars, that can save them on tax dollars, and still meet the minimum requirements of the Affordable Care Act, even if your employees don't choose that option. It just has to be available. But in talking about offering minimum affordable care and other options, you're probably wondering, how is this going to be less expensive, or how much is this actually going to cost? It's something that most groups can satisfy by spending between $0 and $100 per month per employee in an employer contribution. I hope you can see that this is a giant breath of fresh air compared to what's actually happening. Now to summarize, group health plans are not subject to many of the rules that health insurance providers are subject to. So allowing the folks from insurance land to come and bind your group health plan forfeits your unique rights as a group health plan provider and begins to create those ugly moral hazards for bad behavior. Instead, group health plans can be structured flexibly, giving employees choices that reward good behavior. And those more reckless participants can still choose that minimum offered coverage without driving up the premiums and experience for everybody else. Whether you like the current healthcare landscape or not, this creates the most efficient setup for you and your employees. Now, you're probably wondering, how do I get started in all of this? How much time will it take? If I decide to self-fund, how much risk am I taking on? What are the ways that this could backfire? Well, that's why Common Care exists. We help companies design, implement, and maintain their own customized health plans in a way that eliminates complexity, mitigates risks, and cuts costs way down. The first step is to get the bones of your plan. Common Care provides free customized plan designs that are AI-driven and legal team reviewed. If you get a little stuck on implementation, Common Care offers low-cost tools that makes it automated to implement your plan according to the ACA requirements. If you're still not comfortable, it is easy to add a third party to help administer your plan. On top of that, to save even more than the initial tax savings, we offer a suite of cost containment tools that are available for purchase either by you or by the participating employees. These are things like private pay networks and billing mediation tools. So what does this look like in the real world? Well, on average, groups that restructure their health plan offering with Common Care are saving about $268 per employee per month using our cost containment strategies. This would mean that an employer with 50 employees is saving about $161,000 a year with another $96,000 in out-of-pocket employee savings. The total cost paid to Common Care for all of this? About $14,000. Now, you have the option as an employer to pay all of that or to pass through some of that along to your employees. With 100 employees, you're looking at $240,000 per year in savings with another $172,000 of employee out-of-pocket savings. And when you get to 500 employees, you're looking at over $1 million in combined employer-employee savings. You can see why exploring this option is a no-brainer for anyone paying out the nose for group health insurance, especially as premiums continue to increase year after year after year. But don't take my word for it. Go over to commoncare.org, follow the prompts, and see what the savings could be for you and your employees.